A small bowel fistula of high volume, 2 weeks after an open abdominal missile injury as described, requires the following staged approach to management. The first priority is to restore the patient's circulatory blood volume to normal, and to correct any existing fluid and electrolyte imbalance from loss of small bowel content. A is correct. If the patient is shocked at presentation, with hypotension and tachycardia, he has a deficit of at least 303 of blood volume, or 1.5 to 2 liters in this 20-year-old man. If he has signs of extracellular fluid, ECF, defect, sunken eyes, firm dry tongue, diminished tissue turgor, he will have a total deficit of around 73 body weight, 5 to 6 liters, and if these signs are combined with signs of circulatory failure, the deficit is likely to be greater than 103 body weight, 8 to 10 liters. Replace the pre-existing deficit as rapidly as possible. Provide daily requirements of fluid and electrolytes, 3 liters of 43 dextrose in 1/5 isotonic saline with 80 mmol potassium daily. Replace continuing small bowel losses, volume for volume, with an equivalent solution, Hartmann solution with added potassium and bicarbonate. Once circulatory and fluid status are satisfactorily restored, MOG 1 nanogram of the fistula to determine its anatomy should be undertaken using plain X-ray, looking for evidence of bowel obstruction or foreign body, abdominal cord with oral or rectal contrast, and perhaps a FLS 2 Fistula losses should be collected and the surrounding skin protected by suitable stomal therapy principles. If there is no evidence of mechanical obstruction, discontinuity or foreign body, conservative treatment as above can be continued in the expectation that spontaneous closure is likely. This may take several weeks and is facilitated by provision of prolonged intravenous nutrition via a central intravenous line, delivering an adequacy of caloric energy with an appropriate proportionality of carbohydrate, hypertonic glucose, essential amino acids, and fat emulsions. The infusion should also provide adequate daily amounts of electrolytes including phosphate, minerals, trace elements, and water-soluble and fat-soluble vitamins to provide total nutrition parenterally. Laparotomy may be required early on to facilitate drainage of infected foci and excision of necrotic tissues or foreign material.